Welcome to Balanced. Today's topic is Ozempic, the weight loss wonder drug. In today's video, we will delve into why everyone is talking about it and if it may be right for you. Ozempic is a medicine that is making big news in today's society. You might have seen it on social media or heard friends talking about it. Originally, doctors gave this medicine to people with type 2 diabetes. It helps control their blood sugar. The medicine is an injection that you take once a week. The active ingredient is called semaglutide. It works by copying a natural hormone in your body. This hormone helps your body make more insulin when you eat. It also tells your liver not to release too much sugar. This is very helpful for managing diabetes. But soon, people discovered another effect of Ozempic. It slows down how quickly food leaves your stomach. This makes you feel full for a longer time. When you feel full, you tend to eat less. Because of this, many people started losing weight while taking the medicine. This off-label use for weight loss became extremely popular. The news spread fast, and suddenly, many people who did not have diabetes wanted to try it. It became known as a powerful tool for people struggling to lose weight when diet and exercise were not enough. The popularity of Ozempic and similar drugs, like Wegovy and Mounjaro, has grown so much. In fact, reports show that 1 in every 8 Americans has used one of these medicines. They are called GLP-1 drugs. The company that makes Ozempic, Novo Nordisk, also created Wegovy. Wegovy has the same main ingredient but is officially approved by the FDA just for weight management. The buzz around these drugs is huge because they offer a new kind of hope for people who have struggled with their weight for a long time. This widespread attention has turned Ozempic into a household name. It represents a major change in how we think about and treat obesity. For many, it feels like a breakthrough, a real solution after years of trying other methods. However, with all the excitement, it is important to understand the full story. We need to look at both the good things and the potential problems. This video will help you see the complete picture, so you can understand if this medicine is a wonder, a worry, or a little bit of both. The most famous benefit of Ozempic is, of course, weight loss. The results can be truly amazing. Scientific studies have shown that people using semaglutide can lose a significant amount of weight. One large study found that people with obesity lost an average of 15% of their body weight over about a year and a half. This is much more than the 2.4% lost by people who only use diet and exercise. For someone who weighs 200 pounds, a 15% loss means losing 30 pounds. This can be a life-changing amount of weight for many individuals. Personal stories show the real impact of this weight loss. There are individuals who report having lost all of 80 pounds over 2 years while using a GLP-1 drug. This incredible change did more than just help them feel better in their clothes. It also improved their overall health in very important ways. Blood pressure, which used to be high, returned to a normal, healthy level. Stories like these are common. They show how these medicines can help people achieve health goals they thought were out of reach. It is why some doctors call these drugs game-changing. But the good news does not stop with weight loss and blood pressure. New research shows that these drugs can also be very good for your heart. People who use them have a lower risk of serious heart problems, like a heart attack or a stroke. This is a huge benefit because heart disease is a leading cause of health issues for people who are overweight. The medicine seems to help the heart in ways that go beyond just losing weight, making it a powerful tool for cardiovascular protection and long-term wellness. Even more surprising are the potential benefits for the brain. A major study published in January 2025 looked at the health records of over 2 million people. It found that GLP-1 drugs were linked to a lower risk of many brain-related issues. This includes a reduced risk of addiction to things like alcohol or opioids. The study also saw a lower risk of seizures, depression, and even neurocognitive disorders like Alzheimer's disease. Scientists think the drug might work on brain receptors that control rewards and impulses, and it may also reduce inflammation in the brain. While the benefits of Ozempic are exciting, it is very important to know about the risks and side effects. Like any medicine, it is not perfect for everyone. The most common problems are related to your stomach. Many people experience things like nausea, which is feeling sick to your stomach. Vomiting, diarrhea, and constipation are also common. Some people get stomach pain or indigestion. For most users, these side effects are mild and may go away over time. However, for others, they can be quite uncomfortable and make it hard to continue taking the medicine. Beyond the common stomach issues, there are more serious risks to consider. Although rare, Ozempic can cause a condition called gastroparesis, which means the stomach becomes paralyzed and cannot empty itself properly. This can be a severe and painful problem. There is also an increased risk of pancreatitis, which is a painful inflammation of the pancreas. The medicine can also lead to acute kidney injury. A scary thing about kidney problems is that you might not have any symptoms until the damage is already quite advanced. It is also crucial to know about the official warnings that come with Ozempic. The drug has a serious warning about a specific type of thyroid cancer called medullary thyroid carcinoma, or MTC. This risk is low, but it is very real. Because of this, people who have a personal or family history of MTC should not take Ozempic. The same warning applies to people with a rare condition called multiple endocrine neoplasia syndrome type 2, or MEN2. Your doctor will ask about your family's health history to make sure it is safe for you. Other potential issues can also arise from using the drug. Some people report changes to their vision, a condition known as retinopathy. Another side effect is sometimes called Ozempic face. This refers to a gaunt or sagging look on the face. It can happen because of very rapid weight loss, which can cause you to lose fat and muscle from your face and other parts of your body. Understanding all these possible side effects, from the common to the rare, is a key part of making an informed decision about your health. Given all the benefits and risks, how can you approach Ozempic safely? The number one piece of advice from every expert is simple. Always talk to a medical doctor. This is not a medicine you should decide to take on your own. A doctor can look at your complete health history, check for any risks like family thyroid cancer, and decide if you are a good candidate. Ideally, you should work with a team that includes a registered dietitian. They can help you create a full plan that supports your health goals in the best way possible. Medical supervision is not optional, it is essential. Another key piece of advice is to remember that Ozempic is a tool, not a total cure. It works best when it is part of a bigger plan for a healthy lifestyle. This means you still need to focus on eating a balanced diet and getting regular exercise. These lifestyle changes are incredibly important for your long-term success and overall well-being. The medication can help control your appetite and give you a powerful head start, but building healthy habits will help you maintain your progress and feel your best for years to come, even if you stop taking the drug. You also need to be very careful about where you get the medicine. Brand name Ozempic is extremely expensive, and insurance does not always cover it. This high cost has led some people to look for cheaper versions online or at med spas. These are often compounded drugs, which means they are mixed in a special pharmacy. However, these versions are not approved by the FDA. This creates huge safety risks. You might get a product with the wrong dose, no active ingredient at all, or even harmful contaminants that could make you very sick. In the end, the journey with Ozempic is a personal one. The goal should always be your overall health, not just a number on the scale. To make the best choice, you must weigh the potential good against the possible bad. Have an open and honest conversation with your doctor about your goals, your fears, and your lifestyle. They can help you monitor for side effects and make sure you're on the right path. Ozempic can be a wonderful tool for some, but a safe, informed, and doctor-guided approach is the only way to find out if it is the right choice for you. Thanks for joining us. We hope you found this video helpful and informative. If you liked this video, don't forget to give it a thumbs up and to share with a friend. Subscribe and turn on the notification bell so you never miss an upload. Cheers to good health and longevity, and here's to living every day the balanced way.